Our question of the weekend was, will you let your kids trick or treat this year? 59% of you said yes, it'll be easy to socially distance from a porch. 41% said no, we'll be looking for alternative ways to celebrate Halloween. Dr. Kevin Kavanagh, who is a retired physician and founder of Health Watch USA, joins us now. Good morning, Doc.
Oh, good morning, Jack.
And what has the CDC had to say about trick-or-treating this year?
Well, very interesting. We have very detailed, specific guidance regarding Halloweening. And your traditional trick-or-treat activity, which is outdoors, is viewed as a high-risk type of an activity. And the CDC also states that if you participate in a high-risk activity, you should think about trying to isolate yourself as much as possible for 2 weeks after that participation. And so this is really something I think people need to note. These recommendations were very detailed, and in my opinion, we need this detailed with school recommendations and in other types of venues. But here's the thing, Jack. You can read into these recommendations, and I think you can project how you should be acting in other venues. I think it's very important, especially if you read the moderate recommendations. For example, they state that if you're outside, whether it's in a movie that's being participated with the community, you're in a haunted forest, a pumpkin patch, costume parties, and you're 6 feet apart wearing masks, it's still defined as a moderate risk activity. So you have to ask yourself, well, what about protests, political events, funerals, and political rallies? To me, it's just, even if it's outdoors, there's still a risk. And of course, we've been saying this all along. And if you look at moderate risk activities, and this really caught my eye, if you're in an area where there is screaming, being 6 feet apart or greater, and you want to be greater than 6 feet apart, this is the description of aerosolization, or if that virus is airborne. Screaming is one of the ways that you can make it airborne. Being 6 feet apart isn't enough. You want to be further away than that, preferably with an N95 mask. And this is guidance outdoors. It's not even indoors. So there's a lot in this guidance than rather just Halloweening. And so I think it is very, very important. Now, activities which can be done is mainly family activities. You can have a treasure hunt with your family core unit. You can carve pumpkins, decorate your house, watch a scary movie with your family. All of these should be done. One of the things you don't want to do is to think that wearing a mask, a Halloween mask, is going to protect you from the coronavirus. It won't. And you should also be discouraged from wearing both a Halloween mask and a regular mask. CDC said this may or may not be safe to do. These recommendations, I was quite excited, not only that they're detailed, they tell you what you can do, can't do, as far as a low, medium, high-risk activity. And believe me, I think they should be like this for about every sort of venue and activity that we have.
All right, now tell us about the announcement that came regarding in-person classes at Fayette County.
Well, this is an announcement, and I think in view of our Halloween recommendations, you can understand why this came about. The announcement is pretty much that, well, we can't go back to classes if we're in the red. We're unlikely to be out of the red zone if UK is still in session, and that we may have to put off in-person classes, and we also may have to do this until either we get a vaccine or our rates drop. And so this is important. And being in the red means that you have greater than 25 new cases per day per 100,000 of coronavirus. And so this is important. And I think the Halloween recommendations underscores the problem with aerosolization of the virus. Because as you know, in the school, especially grade schools, if you've ever been in the hallways, they're loud. People are talking very loudly, sometimes screaming. You have people that are close together. The school air may or may not be up to where it should be with the number of ventilations and cleanings per hour, and also making sure that it's being sanitized. So all of these things should be done before we go back to school. We need social distancing, proper PPE, sanitization of the air with proper circulation, at least 6 to 10 times per hour. And then, of course, we need to have low rates of the virus in the community. And you really need to ask yourself, are we going to be able to do all this, plus maintain the activities that we're currently maintaining in Kentucky, i.e. open bars, indoors dining? There's ways to do that safer. And I've said this before, we need to get some state grants to get air filtration, air sanitation up to snuff in many, many different buildings, schools, plus retail buildings.
All right, Dr. Kevin Kavanagh, thank you so much, and we'll talk to you Wednesday.
Thank you, Jack.
Dr. K.